More positive news coming in terms of how Mumbai has tackled the coronavirus, and the positive news coming out of Mumbai's battle against COVID-19 is that the number of cases per day have come down substantially. At the moment, Mumbai was once, of course, the worst hit city in terms of COVID cases, has made giant strides in this fight. Speaking to Mirror Now, health expert Neeraj Hatekar says that there are multiple indicators that the worst may be over for Mumbai. So that's the positive part and good news indeed for Mumbaikars. Both the doubling rate and the positivity rate in the city has improved considerably, and beds are available in hospitals which was once bursting at the seams. So let's listen in to the important points about how Mumbai is improving and slowly recovering from the COVID-19 battle.
I think the situation is definitely improving. I don't know whether the worst is over because we don't even know what the worst is going to be. But the situation is definitely improving, and I think it started to improve sometimes in the third week of May itself. You see, we monitor it with three parameters really. One is the doubling period, and the doubling period in Mumbai has been consistently rising from May. It's now 45-46 days. The second thing that we use is what is called an R, a daily effective R. That's the number of people a single infection reinfects. And that R has been consistently declining. And for the last 20 days, for example, it's fallen from about 1.1 to 1.06. So it means that about 100 infected people in Mumbai now reinfect about 106 people. So, so that is a manageable kind of a situation. The positivity rate has also been declining from June, and it's now even more pronounced in July. And also, you see, hospitals are now reacting. Now, for example, in some public hospitals, COVID beds are actually now relatively empty, and doctors are now paying attention to other kinds of work. So definitely, the situation has improved surely in Mumbai.
My colleague Disha Shah joining me live. Disha, we have a lot of data now that is indicating that perhaps Mumbai is over with the worst, but yet we have to exercise caution. We cannot lower our guards. Give us the important findings and what they imply so far in Mumbai's battle against COVID-19.
Well, that's right. We heard the health expert actually talking about various parameters that have led to the decline in the number of COVID infections here in the city of Mumbai. The doubling rate has improved. It's at 72 days now. If you talk about the positivity rate per day, that also has seen an improvement. That is merely 9% against what it used to be 22% about 20 days ago. If you talk about the other aspect about the infection growth rate, because that is something which is very important here to note that the speed at which the infection is actually growing, that also is reducing at this point in time. It is less than 1% per day. So 0.97% only. But definitely if you talk about, lowering the guard, that is something that Mumbai city cannot afford to do this at this point in time. And there are various reasons. On one hand, actually, we are looking at that how the situation is improving. But on the other hand, it is also very important to note that the city has not opened up fully yet. Health experts believe that we cannot really call it a win-win situation just like that now, because public transport is yet to reopen in the city. Once public transport reopens, then we will actually see the number of infections rising up. So that is, of course, one parameter that, Mumbaikars will have to be a little cautious about. On the other hand, if you talk about right now in the slum areas, definitely at least 57% of the people have been exposed to the virus, which essentially means that they have become immune to the system. Antibodies have been developed. But these are only temporary antibodies is what the health experts believe. After 2 to 3 months, antibodies eventually die and, reinfections might really come up. So these are certain measures, of course, that the health experts are looking at this point in time. However, definitely on ground, BMC has, taken a lot of measures which has brought down the decline in the COVID positive cases. But on the other hand, we are still looking at a peak which the health experts believe might come 1 month down the line.
All right, Disha, stay with us. Let's, in fact, also tell our viewers that while there may be many positive things at the moment, this is no time to lower the guard, because there is a possibility, like you said, of reinfection, even if the presence of antibodies are found, which is temporary. And secondly, the issue of asymptomatic carriers also remain. Mumbaikars, therefore, cannot really take it easy immediately. Let's listen into some more inputs coming in.
You see, we have seen, for example, in April and May, we thought that Kerala had sort of managed to control the disease. Kerala had a doubling period of course 50 days, and lo and behold, over a week it dropped rapidly. Telangana seemed to have won. Punjab seemed to have was doing very well. But all these situations have now gone. Things have reversed very quickly. So for COVID infections, you don't know. You see, because the virus changes its nature. And it's a very complex situation. So I think let's not simplify it. All that we can say is that things have become improved, and we must consolidate these by continually being on our guard. You see, one major problem is that if the virus has slowed down in the city because a lot of people have already been infected, now current state of knowledge says that once having been infected, you have immunity which is a short-term immunity, which might not be a long-term immunity. So it might be possible that maybe people who have been infected in May might also actually be susceptible again in July or August. So once we are opening up, we might even see a second phase coming in. So we must be all on our guard.